provide education and clinicals for nurses that are returning to practice. So whether you're an LVN, an RN, or a nurse practitioner, if you once had a license, we can help you get it back. The most common story I hear is nurses who left the practice to raise kids. They've been doing the most important job of any mother, being at home for their own children. So now that they've got the little ones in school, they're getting a chance to get their careers back on path again, and they're excited to return to what they first loved, was their passion for nursing. So we assist them in getting that license back, going back to school, and doing all the things that they need to do that. Cover a review of physical assessment, medication administration, pharmacology, documentation, and nursing jurisprudence and ethics. Those are our 5 core curriculum. Then we have optional classes that I encourage people to do, which include the skills lab. You see the mannequins over here, and we do with baby, junior, and adult mannequins. We're doing things like tracheostomy and Foley care. And then we have an IV therapy lab. And I am so excited that we are affiliating with 2 major nursing universities, and we're going to be adding our nurse refreshers an option to go into their simulated labs. They'll be able to listen to lung sounds and practice more advanced skills and code the patient and birth the baby if they want, and whatever their specialty is, to provide that kind of level of expertise. I'm just so wonderfully excited. Those programs are $1 million programs, and we're just, really pleased to be able to offer those opportunities. And we have already had some students going through the program in Dallas, and we're just, minutes away from inking the paper for Houston. So I'm really happy about that opportunity. People do what's convenient for them. We have people that are doing this because they're anticipating maybe a layoff in another industry. So they may come 1 day a week and take the class that's offered until they can get through. So it may take them 6 to 8 weeks to finish. Other people will come when we're having the courses in a row. So they'll finish the classroom part in about 2 weeks. So it really varies depending on the person. We're in Houston, which is our home base here. It's Houston suburb called Stafford, 9 times a year. Then we go to Dallas 4 times a year, and then San Antonio 3. And so we may be expanding that further, but at this time, that's where the actual classrooms are held. So they can fit in anywhere that works for them. Once you finish the course curriculum, we assign you to one of our clinical sites where we already have affiliations. You'll do your assigned number of clinical hours, which can range from a minimum of 80 to a maximum of 160 hours to make sure you individually feel confident to practice. Then we process all your paperwork, send it to the Board of Nursing, kind of like a transcript. And then there's an exam that you take online, and that gets you your final license. That takes about 3 weeks after the paperwork is all turned into the Board of Nursing. And then you go out and you start looking for a job because you've got an active license again. There are other companies that provide the services. Many of them actually are universities and colleges. And the biggest difference is you get assigned a student ID, and you're one person in the thousands, tens of thousands that they service. You're not a student ID number here. I know you individually. I speak with each of my students, find out their goals, what they really had a passion for, but they think that's too far gone and they can't do that anymore, and try and help them get to what they individually want to do. We provide a mini-mester of nursing, and then assist them and walk them through the board processes and back through clinicals. The universities are very rigid. They've just started to really take off with online education. They're used to doing things the same old way. So they want you to come for a semester and sit in class every 3 days and do it that way. And many of our nurses are very anxious to return, or their schedules are very limited, so they can't come to that kind of program. So we provide a very unique, customized service for them. I think that we're accountable. We look at each of our students individually because they're not returning to us, but they're going to refer someone to us. We look at them as an investment, as part of our product. So We want our product, which is the student in this case, to be good. So we try and assist them and make sure we not only educate them, but motivate them, empower them, inspire them. It sounds like a lot to take on, but I'm up for the job. So we just really take pride in providing a great service experience to our nurses, that assisting them along this journey is a friend.